Today I've responded to a 25-year-old male whose chief complaint is loss of consciousness. He was sitting at his desk working all day when he stood up quickly and felt lightheaded. He then proceeded to lose consciousness, falling on his arm. As I enter the scene, I can tell it's a safe environment, as there are no hazards and it is located at a safe residential address. My patient's vital signs are a diastolic blood pressure of 80, a systolic blood pressure of 110, blood glucose level of 4.5 moles, a temperature of 36.8 degrees, a heart rate of 80, respiratory rate of 16, and oxygen saturations of 99. So I find the patient on the living room floor in his home in the recovery position. There is no evidence of trauma, such as bleeding from the head, and the patient is alert and responding to me, and does not appear to be in pain, just shaken up. So this is my patient here, Taz. He's obviously positioned himself in the recovery position and has been able to call for help independently. Hi there.
Hi.
Can you tell me what happened today?
Yeah, I was sitting at my desk working all morning and I stood up suddenly and I started to feel lightheaded and then I fell over and I landed on my arm.
Okay. Did you completely lose consciousness?
No, I didn't.
Okay. Did you hit your head at all?
No.
Okay. How are you feeling now?
I feel okay now.
Okay. Not dizzy or lightheaded at all?
No.
Okay. Are you able to sit up for me?
Yeah.
So the initial assessment I'm going to do is a neurological assessment. This is important due to the fact that the patient may have hit their head or may have something else neurological going on causing them to lose consciousness. I've already been able to assess part of the patient's GCS by noting his eyes were open when I arrived, giving me an eye-opening score of 4 and a bang commands giving me a motor response of 6. Can you also tell me what year it is?
It's 2018.
Great. So now this gives me a verbal response of 5 with an overall GCS of 15. Now I'm going to assess the patient's risk of stroke by using a FAST test, which is face, arms, speech and time. Can you look straight at me and smile? Wonderful. So I'm looking for any unevenness in the smile or in the face, which I can't see, which is great. Can you please squeeze both my hands? I'm looking for any unevenness in either of the hands or arms. If you can stretch your arms out in front of me and push up. Great. You can pop your arms down. Can you also tell me what year it is in your address?
It's 2018 and my address is 30 Abbott Street, Naya.
Wonderful. So I'm looking for any speech difficulties, slurring, and to make sure that he comprehends what I'm saying to rule out any confusion. I'll also test his coordination with a finger to nose test. So I'll just get you to touch your nose and then touch my finger continuously. Yeah. And finally, I'll check his pupils to make sure that they're equal and reactive on both sides by using a light. So if you can just look straight at me, I'm just going to shine a light close to your eyes, and you just keep your eyes open for me. Okay. Great, so they're both equal and reactive. So now I can rule out a stroke. I can rule out any concussion, and I'm confident that there was no other neurological issues which caused him to lose consciousness. So now I'm going to take some history of the patient to see if there's anything else that could have added into him losing consciousness today. So, have you had anything to eat today?
No, I haven't. No.
Okay, have you had anything to drink today?
No.
Okay. Do you have epilepsy or diabetes?
No, I don't know.
Okay. And have you ever had anything like this happen to you before?
Once before, the same kind of thing happened, and that was when I hadn't eaten or drank anything either.
Okay. Now I'm going to go through the 6 P's of musculoskeletal assessment: pain, pallor, paresthesia, pulses, paralysis, and pressure. Now I'm going to assess your wrist, is that okay?
Yeah, that's fine.
Great. I'm going to check pain on palpation. So if you can place your wrist out. Is there any pain down your arm?
No.
Great. And I'm also going to check pain upon movement. If you can rotate your wrist for me. Is there any pain?
No.
Wonderful. Paralysis, I'm going to check now. So if you can place your hand out and if you can feel my sensation of my hand, okay?
Yeah, I can feel that.
No worries, it feels normal?
Yeah.
Great. This also rules out paralysis. Now I'm going to check pallor. So I can see that the skin is pink, not pale, and it feels warm. I'm just going to squeeze your hand and check your capillary refill. I can see his capillary refill is less than 2 seconds. Now I'm going to check for paresthesia. So do you have any pins and needles or numbness in your fingers or hand?
No.
Great. And I'm also going to check his pulse. So I'm just going to take your radial pulse. Great, so I can see that he has a strong radial pulse. I'm also going to check for pressure. If you can just squeeze my hand. Great. So that completes the 6 P's of musculoskeletal assessment. Now I'm going to do a snuff box test to rule out a common scaphoid fracture. If you can place your hand out, pull your thumb up. Wonderful. I'm just going to put pressure in here. Can you tell me if there's any pain?
No, there's nothing.
Great. And I'm also going to do a radial, ulnar and median nerve check. So if you can copy me and do paper, scissors, oh, thumbs up. And there's no pain during that?
No, it's fine.
Great. Now this rules out any major trauma to do with the wrist or nerves. So I'm happy to rule out that there's no other underlying causes for Taz to have lost consciousness today, and that it's solely on the fact that he didn't have anything to eat or drink and then stood up quickly. Based on that, this has happened to him in the past as well. The outcome of my assessments today is that the loss in consciousness was caused due to syncope, as the patient was sitting for a long period of time without eating or drinking, and then suddenly stood up, creating a brief period of hypertension, causing a lack of oxygen to the brain. Other reasons why a patient has a transient loss of consciousness is postural hypertension, dehydration, diabetes due to excessive blood sugars, epilepsy due to seizures, and psychiatric reasons due to anxiety or hyperventilation.